Welcome back to the morning show on Tobago Updates. I am Adanna Combie, your host, and we are going to have conversations with Dr. Faith B.Yisrael. And of course, we're talking about the end of the mandatory mask wearing. We know we just came out of, well, when I say just a couple of months ago, came out of a global pandemic known as COVID-19. And one of the measures that had to be taken was us wearing masks, sanitizing, and stuff. And we have seen an end come to the mask wearing over the past week or so. And so we're going to talk a little bit about that. What does it mean for us on a global scale? What does it mean for us here in Tobago? And how do we move forward? What are the expectations? And we have our doctor in the house this morning. Good morning, Dr. Faith. How are you? Welcome to our program.
Good morning. Thanks for having me.
Right, it's always a pleasure having you here on the program. So we're going straight into it. We're talking about an end has come. I know a lot of people are now breathing a sigh of relief that they can now take these masks off, that we could walk freely in the streets of Scarborough. We could walk freely. We could, do the things that we enjoy doing and not being restricted to the mask wearing. But I also see some people still wearing the mask, and we're going to talk about that a little bit later on. But tell us, well, we know the decision was made. What was the thing that brought the decision, and how do we move forward?
Certainly. So, the last set of regulations relating to COVID 19, which were done a couple weeks ago, really just removed all of the restrictions except one, all of the COVID 19 restrictions except one. The World Health Organization has for several months said that COVID 19 is no longer an issue of public health concern. It was no longer classified as a pandemic. So we have been moving away from looking at COVID 19 the way we did in 2019, 2020, and for the couple of years following. But the last set of restrictions basically said that the only thing that was mandated in Trinidad and Tobago was that you still needed to wear the mask when you were in a health facility. So, a health center, hospital, whatever, whether it's private or government run, you still needed to wear the mask in a health facility. And it was the last measure that we were putting in place nationally. The document or the legislation basically said that as that timeline was up to the 31st of July. Now, usually what happened, and this has been happening, and I guess people don't realize how it's done, since 2020, what we've been doing is putting beginning and end dates to legislations. And that's why you would hear the Prime Minister come on and say, as of midnight tonight.
The
Those
famous
things.
statement.
Exactly, as of midnight tonight. And that is really because the legislation said as of midnight that night till midnight several months later, this was going to be the law. So the last set of legislations basically said that as of midnight that night, whatever it was, until the 31st of July, we still needed to wear the mask in our health facilities. And what they have done this time is that coming when that deadline came to an end, they did not renew it, because that is in essence what they've been doing for the last couple of years. When we get close to the deadline, we look at the statistics, we look at what is happening, we look at our hospital numbers and so forth, and determine whether we need to extend, in essence, the deadline. In this situation, we decided that we were not going to extend the deadline. So a notice just came from the Ministry of Health indicating that as of, in essence, the 1st of August,
August.
no longer needed to wear the mask in our health facilities.
Now, what does this mean? Does this mean that we now have, I know you said that it's no longer a pandemic, but we still have to exercise some measure of precaution. We are still responsible for ensuring that our health is in the right place. We are still responsible. We have a social responsibility as well if we know we have an illness, to protect ourselves and those in our reach, right? So tell us a little bit more about that. Give us some guidelines as to how we manage, how do we move forward? Because I know a lot of people take it for granted. I mean, the general public, we have stopped wearing masks for a long time. And as you did mention, it was really primarily for health institutions, whether private or public. When we go into the clinics or the hospitals or the health centers, we were required to wear masks. Now that that has been removed, people will think, the general public will think, well, okay, pandemic gone, COVID gone, we don't have to worry about that again. And then sometimes we can let our guards down and just live blasé. What are your recommendations or your advice in moving forward out of this pandemic? Because I mean, there are other things in the air. There are still viruses, there are still illnesses. It's just that we don't have a global pandemic, but we have to take responsibility for our own health. How do you advise us?
So I have always said that even when the general public was told you don't need to wear a mask, if you think that you are a vulnerable person, meaning you have a comorbidity, or you think you are the one who actually has a cold or a flu, then you should keep wearing your mask. And you are right. We've seen quite a number of people who have continued wearing their mask when they are outside. There are individuals, for example, who may have gone through specific treatments, and they are required to continue wearing their masks to protect themselves. So, yes, it goes back to having personal responsibility. If you think that you are vulnerable, you think that you are going into a space where there are, too many people, or is the possibility that someone there might be sick and might be spreading something that you don't want to catch, you definitely keep wearing your mask. Now, the other thing we need to be conscious of is that healthcare professionals are required to still use whatever is their infection prevention and control protocol in the health facilities. So, depending on where you are working, what ward you're working in or what you're doing in the health center or in the hospital, you may still be required to wear a mask, to wear your PPE as part of your normal functioning in the health facility. So, again, if you think that you are vulnerable, if you think that you still need to wear your mask, if you have a cold or a flu and you don't want to spread it to other people, you definitely still wear your mask, but it is not mandated by the government. That's the only removal of the stipulation. It's no longer a mandate that forces you to do it. But if you think you need to do it, go right ahead.
And I like the fact that you touched on practitioners having to wear their PPE, because I know sometimes we could think, oh, well, how come them still wearing masks? They're trying to trick us. You know, the general public, right? So they have been wearing their masks and all their PPE before COVID-19. They have been wearing them before, and so they will continue as they practice in the medical field as a requirement to safeguard themselves and also the patients who are in their care. And this decision, of course, as you mentioned earlier, it didn't just come from the air, right? The WHO, of course, is in charge or at the head of this. And of course, advice would come, recommendations would come. And this, of course, is what helped you to make the decision at the decision making level, of course. After the assessments, which you mentioned earlier, after the assessments were made, there are no more, the hospital beds are now free. We have no more reports. We have the incidents reducing, and we have everything sort of under control. So, of course, I celebrate the fact that we can move forward from this. It gives you a sense of relief. You could breathe a sigh of relief if the medical practitioners are saying that we no longer are mandated to wear these things in this space. It does give you a level of comfort so that you can move forward. But guys, remember, our doctor said you are responsible for your own health. You also have a social responsibility for those also in your care. Tell us a little bit of anything that you want to say or advise the public on or touch on before we wrap this morning.
Certainly, I just want to encourage people to. One of the things we've noticed though is that since we have not been pushing the wash, because remember when we were talking about COVID, we kept talking about washing your hands and so forth. We have been seeing a re-emergence of diseases that are associated with people not washing their hands, and not washing their hands, particularly after they use the bathroom. People, especially those who are dealing with food. Let me go into the Tobago slang. All you wash all your hands, please. All you don't be nasty. Wash all your hands, please. Wash your hands with soap and water, because we recognize that the gastrointestinal diseases, those that come because we have possibly fecal matter that got into food, those are picking up again. So all you wash all your hands, please. Don't stop washing your hands because we no longer have COVID, because we are seeing a re-emergence of those other kinds of diseases, and we don't want to have to treat with that either. So just be overall clean when you are preparing food. Not even when you're preparing food. You come out of the bathroom, you have been picking your nose. Wash your hand.
General
Wash.
cleanliness. General
Yes.
cleanliness and personal hygiene. So, guys, you heard it there. Not from me, from the doctor, certified, and she know what she's talking about. Wash all your hand, please, and maintain a level of good health. Right. Thank you so much, Dr. Faith B.Yisrael, for joining us this morning and for bringing some clarity on the end of the mask wearing mandate. Thank you so much and do have a great day. Guys,
Thanks for
we're going to a break. But of course, before we go to the break and before we come back with our Assemblyman Sonny Craig, remember to share the live, share the live, share the live.